Hello and welcome back for the second panel. Really big thanks to everyone. I enjoyed the first panel on the international, the global dimension. And now we take it further, one step down, I think more concrete and closer to all our realities with the European dimension. How can the EU, the European region, the European Union, be a voice for public health is in the question of the program. And in the program you can see four of our awesome experts. Eric we have already met, and then I think we are really honored, I'm really honored that Jytte Guteland is here today, former member of the European Parliament, current member of the Swedish Parliament. And when you were, Jytte, in the European Parliament, you were dealing with public health, environmental issues a lot, doing really important things for the people of Europe back then. We also have a good friend of mine, Florence Berteletti, the Secretary General of Eurocare, the European Alcohol Policy Alliance, here with us. Florence, it's really great that you are here. You have awesome experience in public health overall, including tobacco control. And for us, it's really great that you are back in alcohol policy. So I think that will be really fantastic to hear from you. And last but really not least, Emil Juslin, the European Policy Officer of IOGT-NTO. And I think at this moment it's maybe more important to just say one more sentence about IOGT-NTO than about you, Emil. IOGT-NTO, I just checked the numbers last night. IOGT-NTO is the biggest social movement in a country in the world. The social movement of people caring about alcohol harm, responding to alcohol harm, working for improving alcohol policy. There is no bigger country-based people's movement. And you represent that movement in the EU, try to navigate EU policy with this Swedish perspective, I think trying to defend Swedish alcohol policy. So this is, and now as well Eric, turned with the back to me, Eric. This is our panel for this next session. I think we have an hour. I'm really looking forward to the discussion. And I would like to begin with the question, how can public health-focused alcohol policy be implemented in the European Union with bigger ambition? How can we bring bigger ambition to alcohol policy in the European Union? Where do you see we are standing right now? And what do you think is needed going forward? And maybe we start from left to right. Jytte, would you take it away?
Thank you so much for giving me this honor to take part of this important discussion together with this excellent panel. I had the privilege of being member of the European Parliament, and now I'm a member of the Swedish Parliament. These questions that we talk about today is really close to my heart. I believe this is the great question, and it's not very easy. I must be a bit humble here because this is a big task. We have so many cultural elements to tackle in dealing with this question, because in Europe the consumption of alcohol is greater than in many other continents. I think we are the greatest in this consumption, and the wine industry is really strong in many of our countries, and also the other industries. I met it in the European Parliament my first years when we started to talk about the labeling of the when it comes to the wine etiquettes. So we should label and have health warnings, and then I met resistance that I was not. It was a bit of a surprise how strong it was and how much wine was seen as something that is a bit not the same as milk or juice or anything other that we drink. It is something that's called more something mysterious, something that adds to our life. It has nothing to do with getting something in our body. It has more to do with experience, being together with other people in the most delicious parts of life. So we're really dealing with that idea of what is a good life. So I think we need to need strong information campaigns to make sure that people are aware how dangerous it is to have the consumption that we have in Europe today. We need to link it to how many people that are actually affected and in risk of getting cancer in the future or already there. So we need to even though there is knowledge about this, the Swedish people don't know about it. I know that for sure. They have no idea. We had the other year, there was information about what the Swedish people think about this. And I think I will be corrected if I say the wrong number, but I think there was something like 14% or so that knows that there is a link between drinking alcohol and getting cancer. So most people have no idea. And that's a big difference when it comes to smoking. People are very aware that this is dangerous. So I think this is very important, that we get the information out, that we have strong information campaigns. And then, of course, we must get it on the political agenda to do things here. And then we need representatives in all the election movements that are speaking about it. So I think the next election, we need to put it on the European agenda once again and make sure that the election movement 2024 is about the harmful situation that people face when we have this consumption of alcohol. Thank you.
Thank you, Jytte. This is really great to, or let me just say, yes, you'll be fact-checked live here. Emil and Eric will be just joking. But thank you, Jytte. It's really good already, I think, to have this perspective that in 2024 there is a European Parliament election. That's a great opportunity for people in the local communities to actually engage and, as you said, try and make alcohol the priority issue it should be if we look at the health burden. Next in line, Florence, what do you think from your perspective? Where do we stand? Where do we need to go? How do we make alcohol policy more ambitious in the EU?
Oops. Thank you. It's a difficult question to respond to. And I guess I'd like to address two issues. One is what is the EU, and the other is what is public health. And the two don't necessarily match. In fact, it's very difficult to even talk about public health at EU level. So I'm going to start with the EU. The EU has not been kind to alcohol policy, and generally it has not been kind to public health. The EU and the three institutions, including the European Parliament, what are we talking about? We're talking about minimum 25,000 lobbyists walking the streets and influencing the EU policy. In Brussels alone, we're talking about 1.5 billion euros per year invested in lobbying from the corporate movement. And so that's what the EU is. The EU is mainly a market, an economic market, and the industries, all the industries who, by the way, work together in collaboration, where do they lobby? They lobby most at the EU level because that's where they can actually stop countries doing the right thing. So that's one problem. And the other problem is if you ask people at EU level and citizens what is health, what is public health, then generally, they will think of clinics and hospitals and disease management, and they are not going to talk about what health and well-being is. And health and well-being is not created in clinics or hospital, and I'm quoting Dr. Tedros here. More than justice is created in the law courts, or that peace is not created on the battlefield. So to redefine public health and to ensure that we say that it is about population measures and not the individual, which is unfortunately a lot of what the EU is doing, is targeting individual measures, like the individual is responsible for their health, is a challenge. So I suppose I will stop there, because these two challenges need to actually define what we do and how we do it. And then Emil, who's working at EU level, I know he agrees, but he's also very good at circulating all this, and he can then step up and continue.
Thanks, Florence. I think you give a little bit of color to what you also mentioned, Jytte. You came into the parliament and you started dealing with health warning labeling, and all of a sudden there was industry pressure. Heavy industry pressure, as you said, and Florence, you gave us some staggering numbers there. Thanks for outlining this challenge. I will get back to you, Florence, in the next few minutes on, well, what do we do about those two challenges?
How?
Exactly, like Vesna said. So, but for now, thanks. Over to you, Emil.
Thank you very much, and I can only really just agree with what Jytte and Florence just said. I mean, the EU is even if it's changed and it has always been a competitive organization working on competitiveness from the beginning, and that culture and that structure is of course benefiting the alcohol industry and has made the EU a very weak side for working with public health for a long time. And I mean, alcohol is probably one of the best examples of it, I would say, but it's definitely more holistic than that as well. I like how to be a bit optimistic, maybe talk about glass half full on the last panel and similar. But, I mean, we have seen a bit of a change with the pandemic and kind of with in the last few years with health being more on the agenda in the EU. I mean, before the Commission were discussing on removing the DG Santé, their health directorate, but now they are definitely been a stronger voice for the last couple of years. I mean, we have some positive energy in that sense, but it's very, very important that we can kind of use that win and strengthen it, and especially into the EU election as well. So what I think we need, I was trying to start talking about a bit about the how and how do we change this kind of culture for making sure that public health is on the agenda, making sure that policy is public health based. I think we need concrete policy, and I think health warnings is a good example, both to strengthen the information among the public, but also among politicians of the risk of alcohol and cancer, for example. I think the cancer plan was a good step towards that the Commission published in 2 years ago. But I think what is also really important is that to build this policy, we need to have the space for it. And I think that's one of the key structural issues on the EU today, how alcohol is discussed in the different DGs and in the parliament and in the council as well. Usually when it's an alcohol working group in the parliament, it's usually industry favored. It usually talks about the wine industry and talking about exports. It doesn't talk about how wine is a public health issue. And similarly, as we know that if the question is have the public health base, it usually leads to better results. So I think we need changes in the council to make sure there's a policy space to discuss alcohol more specifically, that we can build capacity among attachés, but in the governments as well to discuss it from that kind of lens. And similar in the parliament as well. Because as Florence is talking about, I think this is both a good way to strengthen knowledge, but it's also a good way to counteract industry and industry interference. Because now we see that the industry is very uncritically invited to meetings, uncritically part of many discussions when it comes to public health and alcohol policy. And we need to bridge this. And I think this is a very first step for me, at least, to see these kind of structural changes that would put alcohol solely on the public health side and strengthen those sides of it. So I have more to say, but I will start there.
Very good that you have more to say. I like this point, Emil, build space for alcohol policy. And then you mentioned the council, that's our governments. And the parliament, that's us, that's the people. And then, of course, the commission, more technical and bureaucratic. So thanks. I'll pick up also a point here that both you and Florence are raising, public health and how to go beyond public health then. Eric, thanks for your patience so far. you as WHO Europe, you actually work with the European Commission. So maybe that is already an answer to bring more ambition. What would you say?
We can never be too ambitious, Maik, in relation to this. I want to say something about what I think, and this is my personal thing about what I think about how we convince policymakers. I don't think that we should be operating to convince a finance person who's really only interested in finance about health, convince them about the financial arguments. And so the European Union started off as a trading organisation. It was all about business. It was all about trade. It continues to be fundamentally about economic and social prosperity. So what we need to do is enable the policymakers to recognise that that we are aligned in our intentions with alcohol policy. Alcohol harms affect economic and social prosperity. They affect the well-being of societies and the economic success of societies. So by having effective alcohol policies, you achieve those economic and social intentions. So it's not just about health intentions, it's about economic and social intentions. I just want to say another thing in relation to how we actually go about doing this. And Jytte, just to say, it's amazing to have policymakers like yourself really engage with this process and really thinking about it and championing it. And political will, political commitment, sustained political commitment is so important in terms of taking these opportunities forward. As well as that, the partnerships with civil society, I think, are so important, that civil society has links with communities where there's not links with communities. Civil society is communities, and communities are experiencing the harms related to alcohol at individual, community, family, every level, and telling those stories, and also telling policymakers what they think can be done to reduce those harms is really, really important. So building those networks and building those links at different levels is really, really important. And thirdly, I just want to say about evidence. We talked in the previous session about the global strategy on alcohol. We still know that the best buys, so actions to increase price, reduce availability, restrict marketing, are going to be the actions which are going to have the biggest impact in reducing alcohol consumption and alcohol harms. We have really good evidence for that. So what we need to do is make sure that we have the links into policymakers so that well-intentioned policymakers don't tell us about we need more education programs and we need more information programs. Of course we need all of those, but actually those regulatory interventions are the interventions which are going to have the really, really big impact. So we need education, we need information, we need all of that as well as those things, but it's really those, the best buys are what are really going to make the difference in reducing consumption and reducing harms.
Thanks, Eric. And I think you already really stepped into the conversation dimension of this. Emil and Florence talked about public health, and I think you already showed how we can extend beyond public health. Over there, my good colleague Irma is replacing Emil and monitoring the interaction from the participants on Zoom and here in the room.
Yes.
Are there some questions coming for the panel?
Yeah, we not only have a very impressive panel, but we have also very active participants. There are a lot of questions. I think that one of the most interesting ones is there a need for an EU strategy on commercial determinants of health? Is one. Should I take some more, or should we
Maybe
settle?
two, and
Maybe
people
two.
can choose.
Sure. Then we also have another interesting question. How do you work with and think about advertising on alcohol in the internet? Many children are there, and even people with addictions.
Thank you, dear participants. Thank you, Irma. So we have two questions here. What does the panel think about an EU-wide strategy on commercial determinants of health? And what does the panel think about advertising, especially online advertising. Jytte.
Of course, that would be a good idea. I think one of the big obstacles today is actually how strong the influence is from the industry towards the public when it comes to advertising. And I sometimes think I'm still not that old, but I've been here a while now, and I definitely see that things have changed since I was growing up. And if I relate and look at my children, there is advertising all over the place now, and people are also advertising alcohol by themselves, not meaning to do it maybe, but on the social media, showing the labels, showing how nice it is, and therefore information and advertising wine and other alcohol products are really all over the place. And I think for the young generation, this is a huge problem. I did put a motion in the Swedish parliament about this during the fall, and had dialogue here with Emil about it. And I think this is a big problem also in Sweden, because we have a legislation for alcohol towards young people, and that is a quite strong statements. But things have changed with the social media, and it's not updated. So young people face alcohol advertising every day, actually, some. And there have been some investigations, and I don't have to speak to the panel, but that young kids and young people in Europe know more about labeling the alcohol products than the sweets. So I think this is really something we should do. Thank you.
Yeah, thanks, Jytte. I think the way you frame it is really important, that on the one hand, we need recognition of alcohol harm, and on the other hand, we have this avalanche of alcohol advertising, and then children know better which beer brands there are available than which candy brands there are available. So how can we then actually receive and accept the alcohol harm information? So this is really important that you highlight that more needs to be done and be kept pace with the alcohol industry. Emil, I saw you eagerly wanting to speak to which one, the commercial determinants of health, online advertising?
I would like to respond to both. Definitely, I think on the commercial determinants of health, I think it's a really good idea. I think it's a good way to keep the pressure up. I think it's a very beneficial as well, talking about how these interconnect and the similarities between, for example, alcohol and tobacco. And we can also see that the industry is operating in the same way, and we can see the collaborations, especially, for example, during the EU Cancer Plan, we could see a lot of collaboration between alcohol and, for example, unhealthy food, and that they use very similar arguments, and the products often affect people in the same way. So I think there is a need for a strategy like that, and I think it also would help to kind of further bring the debate forward and keeping the public health focus. On the marketing, I also really agree
Emil,
with...
1 second, please.
Yeah?
What is a strategy on commercial determinants of health? What does it do?
So what I would hope would do is they would probably bring a lot of the good ideas from the cancer plan. And I think a fear, at least I have now, is that we have had a commission that has at least seen the connection between alcohol and cancer and worked a lot with it. But there's no guarantee that the next commission, for example, will do that. And we have seen already that in the parliament, it's definitely been quite hard to go forward with alcohol policy as well. So I think in one way it would keep kind of the priority going forward, which I think is very, very important, and that this perspective is kept in the debate. So that I think is a first step. And I also think it hopefully opens up for possibilities to maybe have a working group in the council or in the parliament on commercial determinants of health from a public health perspective. I think that might be easier to do than just speak on alcohol, for example. And hopefully you can kind of bring these, as I talk about the policy spaces, maybe through a strategy like that, and with a commission that is active in it as well.
Yeah, and I interrupted you. You wanted to speak to online advertising as well. Maybe you can do it after. Florence, over to you.
On the commercial determinants of health, this is a concept that needs to be explained and debated at EU level. I'm not so sure I would call on the EU institutions to write a strategy, because that takes a lot of time. But certainly, from a strategic point of view, it is clear that if we want to succeed, answering Vesna's question how, if we are going to make progress, then we need to stop working in silos. And those of us who are working at EU level to ensure, for instance, that we have better labeling and health warnings, or indeed cross-border advertising bans, we need to make alliances amongst ourselves. So it's alcohol is a number one risk factor of non-communicable disease, but unhealthy food and drinks and ultra-processed foods are also a risk factor. Tobacco is a risk factor, and also the oil industry is a commercial determinant of health. And so to bring this, to work more in partnership is important. And the opportunity that we had at EU level was to actually introduce mandatory labeling on alcohol products. It's the only product in Europe which doesn't have a labeling, and it's ludicrous. Now, this particular legislative proposal has been blocked in the EU. Why? Because the commercial determinants of health worked together. They sent letters together, and not to the health commissioner. In the parliament, they acted not in the ENVI committee, although they were very active there. But the major problem, and where we as public health actors need to do better, we need to bring our message to mainly agriculture. The Ministry of Agriculture in all our countries, also at EU level, the Agri Committee, how many of these MEPs in the Agri Committee are our friends? Well, some, but what I think we need to do better is make alliances and send our public health message to DG Agri, to DG Grow, to DG Taxud, and to go there. We have started, Emil and I and our friends, but we need to do better at the next legislation, and we need to call all together to have alcohol products regulated at EU level. And we can do that. If we can't do it under this mandate, because the mandate of the EU is going to finish very soon, we need to call on it for the next one and demand that, you know, this is unacceptable, that people don't know how many calories there are on their alcoholic products, even though as part of a comprehensive alcohol strategy, and call on the other at national level as well.
Yeah. Thanks, Florence. For me, it's unacceptable. People don't know that ethanol in beer, wine, and liquor causes cancer. Even more so what the calories are there. And I think this conversation about commercial determinants of health, the alliances between these health harmful industries, is really helpful for us to just reflect how much we need to come together. For alcohol, there are even other groups, outside health, violence, road safety, young people, and so on. Eric, you have been patient again. Thank you so much. Over to you.
That's rarely said about me, Maik. Thank you.
I said it twice already.
Thank you very much. Yeah. I mean, one of the problems I have in terms of when you're asked a question about do you think we should have this strategy, is that you end up in a kind of dualistic discussion about are you for the strategy or are you against the strategy? And I would say raising awareness of commercial determinants, and more importantly for alcohol, raising awareness that alcohol is no ordinary commodity, and that it impacts on health and well-being far more than it does support kind of, you know, commercial enterprise, is really important. Now, the strategy might do that. It depends who's involved in developing the strategy. It depends what the emphasis is. Is the emphasis to open up, or is it to close down? And for alcohol, we should absolutely be determinedly determinedly closing down. One of the things I think is really, I mean, again, what I think is really important is to build capacity in member states to recognise conflicts of interest and to recognise public health interference. And if I can do an advert for some of WHO's work supported by the European Union, we have a project called Evid Action, which is Evidence into Action Alcohol Project. And as part of that, we are looking to raise awareness and to build capacity within member states to recognise the links between alcohol and cancer, but also to recognise specifically conflicts of interest with the alcohol industry. And I think that actually that capacity building is not don't have a strategy, but absolutely whether you have a strategy or whether you don't have a strategy, you need to build capacity and raise awareness in member states. I'll just say something very quickly about marketing. Just to be clear, and it's in WHO's European Framework for Action on Alcohol, that the best evidence is a global and comprehensive approach to restricting marketing in all contexts is the best way forward.
Thanks, Eric. And I think Jytte and Emil, you wanted to say a little bit more about these questions. Did I get that right?
I actually think the other panelists were saying what I was thinking, so we could move on.
Yeah, fantastic. Yeah. What about you, Emil? Pressure on you now.
Yeah, right. No, but I really agree with Jytte when it comes to the marketing, and I think it's also shows quite a big problem when it comes to the EU as well, is that EU also needs to make sure that they can facilitate for alcohol policy champions among the member states. And this has been a very serious issue for a long time, that member states want to do good policy, but has been even hindered by EU law or been stopped by, for example, competitiveness checks or similar. I think this is also a lot of work that needs to be done, and I think marketing is a really good example of it, where we can see now that we have Lithuania, for example, with their ban working very well, but we need the EU Commission to encourage these countries. And similar with Ireland, with the health warnings, for example. I think there we have a lot of work to do as well to make sure that countries can set the example and can move forward with policy, because we know that we need the member state on board to get this high level as well.
Thanks, Emil. I think this is brilliant to say that in the EU, with all the harm that we have these best practice countries, and they should be leading, so to say. Florence, the final word for this part to you.
Regarding health warnings, because you've mentioned it, the one thing I would say...
I think you mentioned it.
I mentioned the labeling, and you said, absolutely rightly so, that in order to inform the public, they should be aware of the link between alcohol and cancer, or alcohol and cardiovascular disease, or it causes 200 disease and mental problems. So the health warnings are part of the solution. And what I wanted to say is that we should call for the EU to set up a library of health warnings that then member states can take at national level in a safe way. And just to put perspective, to remember that to set up the tobacco library, it took 7 years. So we need to call on the EU to set up this library, and we need to have the best pictures and have more research, but call on them to do so, as well as the labeling. And if I may, there is one thing that we can do at EU level that we're not doing enough yet, is to celebrate the countries that are doing well in alcohol policy. Sweden is one of the best countries in the EU, and whilst there is more to be done within Sweden to improve, to make sure that, you know, your state monopoly stays as it is, to strengthen what you have, Sweden should be at the top of the list if we ranked the different countries in terms of how well they are doing in terms of implementation, how well they are doing to protect their citizens. Then Sweden is at the top. It's no wonder that in the parliament, Swedish parliamentarians are always our friend. And every single Italian MEP, regardless of the political party. They are not. So we should also have this ranking and celebrate those countries per the different things. And we should have that to measure, that will be my last word, the European framework that we have, which will end in 2025. And we should be saying in 2025 which are the countries who have implemented the different aspects of the 6 actions that are in the European framework. So 2025 is really a year where we should really, you know, say, Italy, you've done absolutely nothing, or maybe you've done something good. And Sweden, you've done so many things, and you need to maintain that. And Finland, you should be at the top, and Norway as well. So ranking the countries is important.
Yeah, thanks, Florence. Jytte.
Thank you. Now I got inspired here. But I think from the Swedish perspective, I think we have been a bit challenged during the years in the European Union. And we need to know that this line that we had, we should go on, and we have new challenges with the social media, young people getting exposed and so on that we didn't face before maybe, and also on the EU level. But there were, what I learned when I was in politics and younger and was meeting some of those who worked with the health politics, was that there are 3 things that have been guiding the Swedish alcohol policy, and that has been also all the parties almost have been gathering around almost. And it's the price, to make sure it's not too cheap to buy the alcohol products. It is about access, to have fewer places where it's possible to get it. And then 3, it's absolutely no alcohol when you're a kid, a young, driving, or when you're pregnant. So this is the 3 the words to God. So this is what we should really, and experience it that actually works well. But it has been challenged in many ways during these last maybe 20 years. And I think we should try to instead export these ideas and get them on the EU table. And I also think we should warn that if you live with this idea that we can have this romantic view of how we have the consumption on alcohol products, and in the same time live in this era with the social media exposure for all the youngsters in Europe, then we will have absolutely an even bigger problem in the future. So I think this is, if I should see some big warnings for the future, I think that is, in many of the EU countries today, they don't have the same exposure on the young kids as we do in Sweden, because the kids don't consume social media the way the kids in Sweden does. But in the future, that will change. The Swedish way of having the telephone all over in school and everywhere, I think, unfortunately, that will be more common also in other countries. So most likely, that will be the future, that the kids in more countries will learn about how the best brands, how to buy it, be more interested earlier. If we don't say stop, this is not the way ahead. Sweden maybe is a bit in a better position, and yet our kids are very exposed. But I think the combination for the Italian kids to get that will be a absolutely disaster.
Yeah, thanks, Jytte. As you can see, I have become irrelevant as a moderator. Eric, over to you.
You're not irrelevant, Maik. I mean, I just wanted to say about online context of alcohol marketing. Is there already? Is there across? It's not just Sweden. It's in every country. Kind of use of smartphones is ubiquitous, and in all of their digital spaces, young people are being exposed to alcohol marketing, often not being aware that it's actually even happening, because it's there and you're playing a video game and there just happens to be a glass of beer on the edge of the table beside the picture or something, you know. I think kind of, so it's there already, and it's increasingly, and it's an invasion of children's digital spaces, which is an attack on their human rights. So we need to kind of consider this as a rights-based issue. I think kind of one of the things, the opportunities in terms of moving forward, is that we can engage with young people to challenge that, to work with young people to tell us how to co-create strategies, how to co-create instruments to enable young people to both protect themselves from that marketing in online spaces, but also to tell policymakers what kind of policies they need to have in place to kind of to prevent that exposure, which, as I say, is an attack on human rights. But back to the fundamental in relation to marketing, it is one of the best buys, and actually restricting marketing totally as far as you can in every space that you can, whether it's physical or digital, is going to be the most effective approach and the most easy to implement.
It's actually not me. It's Irma, Emil, others prepared awesome questions for the panel here. I haven't asked any of those, just so you know it, to the point. I think it's really interesting to listen to the conversation. I think we are taking it into different directions, and I think we are connecting to the international, the global discussion, but also to the Swedish one that is coming after the lunch break. So what I would like to do, what I would like to ask is the following. Sweden has world-class alcohol policy. Now we have heard it many times. And at the same time, the alcohol industry is attacking the retail monopolies in Iceland, Norway, Finland, UA is here, is really struggling, and Sweden. The alcohol industry is attacking the French alcohol advertising ban, and they are succeeding. So this is the point that you made earlier, Eric, that we can not just say Sweden has a world-class alcohol policy system and then maybe discuss, maybe we have to protect the kids better from online marketing. How do we protect the whole system that Sweden has, that Norway, other countries have minimum unit pricing in Ireland and in Scotland, for example. And so the question I want to put to you, what are the tools at the EU level to say the countries that are championing this, that are doing well, we protect them or we help them to develop alcohol policy, because Sweden can do better on price, as you have said, Jytte, on marketing, on availability. Are there tools in the cancer plan, in the AVID action that you just mentioned, in the WHO framework for action to help countries protect themselves, but really also be more ambitious?
I can answer quickly by saying that something that I've said already. I think it's extremely important at EU level that we celebrate what was already achieved, so that whatever was achieved can be maintained. I would never, from an EU perspective, tell civil society or organizations that know the Swedish system what to do at national level, but I think to celebrate and to capture the narrative of what is good and what was achieved, that we can do. So it's a question of capturing the narrative, because I think it's the EU commercial determinants of health and the alcohol industry from the EU who's saying, well, you know, the internal market, I mean, the narrative, the bad narrative attacking what was achieved in Sweden comes from the EU. And so we need to be stronger and saying, actually, Sweden is one of the best countries in the world to protect its people, and we need to celebrate that.
Thanks, Florence. So the question I'm asking, are there tools that we can use from the EU to be more ambitious, even in countries like Lithuania? I mentioned some of them that are doing well. Can we be more ambitious? Jytte, what do you see?
I think what we focused on a lot was the labeling, and then also on the commercial, the advertising, and make sure that we can protect the right for the countries to protect their citizens, because with the how it's broadcasted, it's very difficult nowadays to protect your citizens from the advertising, and also on the social media. I think that's the baseline, but then we should add the discussion into this One Health approach and make sure that it is a very strong discussion in this election movement next year to put alcohol on the agenda from the health perspective. And we should make sure that the idea from the parliament to add the causes of cancer into the discussion, and not when we discuss cancer that we discuss only the medicines or the treatments, is really important. That was the focus for our group. So to make sure that that is still protected for the new commission. And then we should also try to, and that's for the parties, but also the civil society, have reports on the economic outcome when we drink more, both on what violence, traffic, health, the pressure on the health systems, because all these things together adds a lot on the society. So we need more information on the costs, and I think we should put that on the Commission's table, so they know that this is not only income from the wine industry or other industries. It is actually also a very strong side on the red figures here.
Thank you, Jytte. Emil.
No, I really agree, and I think there are tools, but I think they're definitely underused. I mean, we hear you talk about health in all policies, for example, and it's a concept that's talked more and more, but I think it's really underutilized. And I think the reality of it is that it's a good idea in the beginning, but it's not really implemented. I would like to see it. And I think that's how we can work. I mean, in the long term, we need to see this shift in the EU where health and other values such as human rights is raised and is always the basis for legislation rather than the competitiveness checks. I think there are short-term tools that can be used already, and I think the EVID Action Project is a really good idea of providing the evidence. Because I mean, as many of you know maybe, but when a country proposes a new legislation that's a limitation of market, but it's usually a good public health measure, for example, a marketing ban, the EU Commission evaluates that if it's a necessary tool to achieve better public health. I think in that context, we have a lot to work on, and I think the Commission can take more lead in making sure that what they are seeing like as efficient policy, that the evidence is there for them to judge and also to celebrate, as Florence is talking about, member states that put public health in the first place. And I would also like to go on with having more health impact assessments on legislation in the EU, instead of having just these impact assessments that are often very a very competitive focus and industry focused. It's a very long-term process, but I think these are the kind of structural long-term changes that are necessary to bring health on the agenda and bring health in its full spectrum, especially on the commercial determinants of health.
Fantastic, Emil. I think this is brilliant. As we know, I think Ireland is right now having to defend its policy, right? And the alcohol industry is leveraging some countries. So this kind of evidence to defend best practice policy, I have not heard that before. So thanks. Eric.
Just to say that I think that we need to have a joined-up approach to all of this. It's not just about tools. It's about a process of building networks, growing the networks that we've already got so that we understand what the needs are to build capacity for implementing effective policies. We've mentioned, I think this has come up a few times, that we don't need to reinvent the wheel in relation to what we know is going to be effective. Action on price availability and marketing and support for health services or services that support health, all of those things are needed, and they all need to happen wherever you are. And so we know that what our member states are telling us is that they don't know how to do it. They don't know how to implement. So I think kind of in terms of tools, what we're doing with the EVID Action Project is we're going to be really kind of focusing as much as possible on implementation tools to support the implementation of effective policies. So at the moment we're beginning work on an implementation tool for pricing policies. So so that for all kind of people involved in the policy making process, what does the evidence say about what's likely to be effective, and what are all the different components that you need to think about having in place to be able to bring this through. And that includes having political support, it includes having public support, it includes paying attention to all of that. Not kind of giving up because you don't think you have it, but actually looking at building that support as an active component of your strategies. And we're also kind of we have a member states focal point which we've established as part of this project, which is very active. We've even got one of them in the room today, and they're telling us kind of what they need, and one of the things that has kind of come out consistently through this discussion is the need to recognise and counteract interference with public health interests. So actually that's a really kind of a key priority, is for us to kind of develop tools and guidance for them to do that. We're also working with young people, for young people to develop guidance for other young people to recognise kind of where alcohol industry is interfering with their online digital spaces. We'll also be developing. So the other thing in relation to evidence in terms of interventions with individuals, screening and brief interventions is a well evidenced approach to kind of intervening early with support to prevent, if possible, kind of alcohol use becoming really problematic for individuals. It's not done enough throughout the region, and it's not done well enough in many places. And we also don't know kind of enough about kind of what actually works in individual situations. So implementation tools to implement screening and brief interventions in primary healthcare, in workplaces, in social services contexts is a priority for us as well.
Thank you, Eric. I think we all can see, in the absence of the EU alcohol strategy, we lost it in 2012, somewhere around then. WHO Europe has really emerged as an engine for alcohol policy in the EU and in the wider region. You just summarized some of these really impressive things. I think, Christina, you spoke to this in the previous panel. This kind of leadership matters for the EU, for the countries, for the global level. So I think it's time to wrap up. I think we can consider that you have actually already sent key messages, important reflections to the next panel when we are discussing the Swedish alcohol policy dimension. So thank you, Jytte, Florence, Emil, and Eric. I learned a lot. I took so many notes that the ink ran out, so I had to go and pick a new pen. But let me say, I think, how do we make alcohol policy more ambitious? In the EU level, you guys talked about 8 ways to do this. Go beyond health, go towards agriculture, for example, and finance. Support the champions, celebrate the champions, but also support them. Awareness raising, increase the recognition of people, that alcohol is no ordinary commodity, that alcohol causes cancer, that our societies lose on alcohol. Counter the alcohol industry, protect against conflict of interest, and increase capacity of governments to protect themselves, to identify conflicts of interest, and maybe even civil society to work together to be able to, I think, stand up strong against health harmful industries collaborating. We have this kind of health impact assessment and generating more evidence on the potential, the impact of positive alcohol policy or ambitious alcohol policy in the different countries. I have heard human rights-based approach, anchoring alcohol policy more in human rights, challenging the European Commission and governments on that. And last but not least, capacity building and implementation tools. Something that Christina mentioned is lacking at the global level. It's really good to hear that you are bringing this to the regional level. These are the 8 points. Thank you, Irma, and a representative for you to all the participants. We only had the chance to discuss 2 questions. Thank you so much for this panel. Fantastic. I learned a lot.